supposed to be here. I don't know if the heat got them or what, but anyway, we're ready to start. So thank you everybody for being here tonight. We're going to talk about the nervous system in health and disease. I'm Dr. Paul Firnhaber, as you know. And tonight, we want to talk about really how the body works. And I want to talk about, why we're here tonight. And the reason that we're here tonight with this particular topic is because I want people to understand, have a much more intimate relationship of how the nervous system affects the body's health, how the body responds to nervous system function, and what happens when the nervous system is not functioning like it's supposed to. So we're going to take a deep dive into that whole subject tonight. Now, most people, I would say, don't necessarily connect the nervous system with health and disease. I mean, what would you guys say? What would you say, Adam?
Well, it's just something that works on the side for most people.
Yeah, it's like something neurologists deal with, but it's not something that really is intimately associated with our health. But let's see. Okay. We got a nice little sound effect right there. Not sure why this isn't working tonight. So,
must be the heat.
okay, here we go. You have in your nervous system what we call a built-in safety pin. It's your own God-given care and rescue mission or mechanism. It's 100% God-given. And the safety pin this is our brain-body model. And this is the brain, this is the body, and these are the two parts of our nervous system that correct the brain and that connect the brain and the body. And here we have what's called a subluxation. And when a subluxation happens, we have a disconnect between the brain and the body. All primary care doctors who care for people with the primary intention to enhance and express life understand the system. And that's what chiropractors do. We study how to give people health and how to express life. Whereas the medical profession, they're more into how does disease happen and how do people die. There's a very different philosophical basis between the two of us. If you look at the brain and this law of the brain-body diagram, this is not a philosophy. This is actual scientific fact. It's a fact of physiology. The body sends messages to the brain, letting it know what it is experiencing. The brain sends messages back to the body, telling the body how to adapt. These are loops of communication. Now I'm going to tell you how to remember these. The efferent pathway is from the brain to the body. So you remember like effervescing bubbles, out of the brain and into the body. That's the way I remember that. So the efferent pathway is the brain to the body. The afferent pathway is the body to the brain. And here you see it with the organs and the autonomic nervous system. You have the brain sending messages to the autonomic nervous system adapting, sending messages back to the brain. Anyone who does not know this or respect this efferent system is violating, before diagnosing, is violating one of the fundamental laws of life. Is that this is very, very important to how the body actually functions. Now, how important is the nerve supply from the brain to the body? Let's talk about 3 scenarios. Bad scenario number 1, the guillotine, okay? So, when the head is severed, what happens to the person?
He dies.
Why? Why does a person die?
It interrupts the head and the body, interrupts the nervous system and the circulatory system.
Yeah,
and,
well,
and you can't live without both.
Yeah, the electrical nerve supply from the brain to the body severed immediately. You have to have that to live. Okay, so the French realized that. You know, they developed this thing called the guillotine, which made that process really fast.
Yeah.
Okay, so let's look at bad scenario number 2, a partial severing of the nerve supply of the brain to the body. Much, but not all of the nerve supply is cut off. So you remember Christopher Reeve, you know, tragic horse accident, severed his spinal cord at the level of C2, and he was paralyzed from the neck down. Okay, he was still able to function a little bit, but not very much. Okay, let's look at bad scenario number 3. Bad scenario number 3 is where we have subluxations interfering with the nerve supply from the brain to the body. Now, the spinal cord isn't totally severed or partially severed, but what we have is the inflammation of a joint causing pressure on a nerve, which can cut off 60% of the nerve flow to an organ or a muscle. Chiropractors are trained to correct these subluxations. If you have these subluxations present in your body, you cannot be healthy. Subluxation that causes pain will eventually destroy your spine if it's not corrected. In other words, and even if it doesn't cause pain, it can still be destroying your spine just by the process of degenerative arthritis. I see people come into me all the time with degenerative arthritis that have very little symptoms in those joints, but their joints are being destroyed because arthritis is a very insidious, subtle process that happens over time, and we don't even realize it's going on. It's like termites eating your house. Okay, if you have termites, they don't destroy your house in a week. Sometimes not even a year. Sometimes it's several years, many years, before it's eaten up, and a lot of the structure needs to be replaced. The same thing with your spine. Now, the origin of life is triggered by what happens in the central nervous system. The brain is constantly doing its best to make endless observations and adaptations to help the body maintain as much life as possible. There's no evidence that a healthy brain can create sickness in the body. By the way, what are some of the things that would make a brain unhealthy?
Injury.
Yeah, that's a good answer. Yeah, like trauma,
Yeah.
like concussion. Okay.
Yeah.
Okay.
Hemorrhage.
Yeah, hemorrhage, any kind of damage to the brain, toxicity. There are things that cause the brain to be unhealthy. And even if you never exercise and you eat a regular diet of junk food, which describes probably at least half of our population, the body is going to try and adapt and do the best it can to create as much healthy tissue as possible to give you another breath. And it's when it can't adapt anymore, when it can no longer adapt, that's when you die. Okay, when adaptation has reached its maximum. So, if you know, I'm a little bit in awe of the central nervous system. It starts with 2 cells, sperm and the egg, which divide exponentially. Next, the brain and the spinal cord are formed. First thing that's formed in the body, brain, spinal cord. Anybody know why that is?
Because everything stems off from that.
Yeah, that's right.
Yeah.
Because the brain and the spinal cord direct and control the development of the human being. And finally, the organs grow off the nerves, which is directed by the brain. Now the body tries to protect itself appropriately. So we have the skull and the spinal cord protecting the brain or the skull and the spine protecting the brain and the spinal cord. Vital organs are protected by the ribs. You think it's a coincidence that the brain and the spinal cord are encased in bone? No. By weight, bone is 9 times stronger than steel. Okay? And by the way, living bone has a much different flexibility than dead bone. Okay? And I mean, you can twist and do a lot more with a living bone than the hard brittleness of a dead bone. Very, very different in how they function. Now, subluxations have been described in 4 different ways, okay? First of all, it's a dysfunctional movement of a joint irritating a nerve, okay? It can be an inflammatory process of ligaments and discs and other tissues surrounding the nerves where they exit from the bones. It can be an outright compression of a disc. And we've seen this, that outright compression of a disc on a nerve. You can see this sometimes on MRIs, okay? However, let me just say this. There's people that come into me that have severe sciatica, and then when you look at an MRI of their lower back, they're fine. They don't have this outright compression of a disc. So this isn't the cause of nerve pressure in the lower back a lot of the time. It is some of the time. Or it can be an electromagnetic charge from an inflammatory response creating tissue changes which emit alteration in tone in the electrical field. So these are 4 ways of looking at a subluxation. By the way, Dr. Adam, I'm just curious, which one is your favorite? Nothing like putting you on the spot, huh?
Probably 4.
Okay, yeah, I could go with that. I could definitely go with that. The scientific evidence proves that people with subluxations, this form of dysfunction, when adjusted, they demonstrate a response which actually makes them better. And there's 3 ways to look at chiropractic. Number 1, I don't believe in chiropractic. I can't imagine anybody with that attitude. Now, are they out there? Yeah, there's some people out there that don't believe in chiropractic. I can't, it's hard for me to imagine that, but there are people like that. Here's another one. Chiropractic is only good for pain relief. Only good, so they treat chiropractic like an aspirin, like a natural aspirin. There's number 3, third way to look at chiropractic. It really enhances the way my entire body works, and thus the expression of life and organ function. I'm going to show you an interesting study here that really validates number 3. Number 2 and number 3 have been validated by the scientific literature for quite a while. See, chiropractic is not necessarily designed to make you instantaneously feel better, but it instantaneously makes you heal better. Now, one of the things that I hear a lot from people, I wouldn't say a lot, but I hear this from people, is that, the last adjustment, I didn't feel any different after that. So I don't know that it worked. So how should I respond to that? My response is, really? So you're so in tune with your efferent nervous system that you know that none of the organs that may not be working 100% are now working better. You can tell that, okay? Because what are they going by? They're going by pain or how they feel. Well, so let me ask you this. Anybody in here ever had a really bad sore throat or an infection that you've taken an antibiotic for? Anybody ever done that? Okay. All of us have at one point. So would you go back to the doctor the second day you're on the antibiotics and say, Doc, I still have the sore throat or I still have the infection. These things aren't working.
Nope.
No, nobody would do that. They give it to you for 10 days. They say, take it for 10 days, okay? So it's just because you don't feel different doesn't mean that it's not working, okay? Maybe your body has different priorities. Maybe it's trying to heal an enlarged heart rather than get rid of the lower back pain, and that's another priority. We don't know, all right? But chiropractic is designed to make you instantaneously heal better. When I adjust somebody, that unleashes hours, maybe even days of healing responses in the body. And you don't know how long it's going to take. In fact, with me personally, I know that in my body, sometimes it takes 24 to 36 hours before I see a change. So I don't get too upset if I don't feel an instantaneous change, because I know that that's the way my body works. Okay? If you study the loop between the brain and the body, do you think that the messages need to travel at 100%? Yes or no?
I think it's better for it too.
Yeah.
They should.
Yeah, they should. It's a lot better, okay? Do you think that you should have 100% gas flow from your gas tank through the fuel line into your engine?
Yeah.
Probably. Probably be a good idea, okay? So, do you think a liver trying to detoxify needs 100% of the nerve energy from the brain to the body? Is that possible?
Mhm.
Yeah. You know, one of the most common problems I find in GI issues is toxic liver. I see that all the time in practice. In fact, a lot of times I will put my hand on somebody's liver and I can feel how inflamed that area is. Liver's on the right side of the body. I can feel how inflamed that area is. People's livers are toxic. They need 100%. Why would they be? Why would people's livers be toxic? Anybody?
Well, the liver does so much. It filters, it stores. A lot of gluconeogenesis goes on there. Glycolysis goes on there.
And that's all normal. That's all normal. But why would it be toxic? Because those things won't make it toxic.
Oh, from drinking alcohol, maybe.
Yeah, it might be what we're
Smoking.
putting into our bodies.
Yeah, smoking.
Might be what we're
Drinking.
exposed to.
Yeah.
You know, when we drive down the street, okay, how many lawns do you see that are perfect? A lot. In my neighborhood, a lot of, how do they get that way?
Spray.
Chemicals.
Yeah.
Well, you think those chemicals just stay on the lawn? The wind blows them, okay? Now, my lawn's not perfect. We have a great crop of dandelions, okay? So we don't spray our lawn, but everybody else does. So we're exposed to all kinds of chemicals. So we need a nervous system that can communicate properly with the liver. Now, does the heart require 100% nerve flow to work properly?
Yeah.
Heart's one of the most well-innervated organs in the body. It's extremely well-innervated. Absolutely. And we can measure this with heart rate variability. We can measure how well the nerve supply of the heart is actually working. Keith Wasung, who's a chiropractic educator, and he's the one that does all the slides that I have on my TV up there, stated that thinking chiropractic as only pain relief is like robbing a bank and stealing only the pens, okay? Because there's so much more to it. I don't get adjusted because I'm in pain. I do sometimes, but I get adjusted just because I want my body to work better, work properly. But let's look at conventional medicine. Got back pain? Let's inject you with enough cortisone to kill all the nerve endings to falsely reduce the swelling so you don't know there's a problem. So you go back to work and re-injure your disc even more. I have a friend who works at one of the big orthopedic places here in town. I'm not going to say where it is or who it is, but she told me that she sees many, many, many steroid injection failures there. But they don't always work. A lot of times they don't work. You know, and is this health care? Does a steroid injection into a sore back create health? No. What does it do?
It covers it up.
Kills the pain, maybe, if they get it right, okay? But it doesn't create health, okay? In fact, there's nothing that's done in conventional medicine that creates health. They can save your life, but they cannot make you healthy. Their drugs don't make you healthy. Their procedures don't make you healthy. They cannot make you healthy. Even if you have an overwhelming infection and you have to take antibiotics to kill the infection, it's still going to degrade your health because it destroys the gut flora in your GI tract. So this is crisis intervention right here. With chiropractic, sometimes a process may be a little slower than a shot, okay? But it's much more in tune with what your body's need is to feel safe. If your body is giving you pain, it's for a reason. Pain is a gift, okay? It's telling you that there's something wrong, just like the oil light in your car. Now, nobody would paint over their oil light if the oil light goes on. You know, most people are not going to take a screwdriver and punch it out and say, okay, we got rid of that problem. You know, what's going to happen?
It's going to blow up.
Engine's going to blow up, okay? Engine will blow up, okay? So we're not here at this office to hide your symptoms and pretend that the efferent nerve pathway is okay. So research has proven that even a minor subluxation can shut down 60% of the nerve flow. The guy who figured that out was a Chinese researcher at the University of Colorado by the name of Chung-Ha Su. And one of the first people that was researching, was doing actual chiropractic research. And he was doing this in the 70s. And he found out that a minor subluxation shuts down 60% of the nerve flow. Only 10% of your nerves deal with pain. The rest support function. So what does that mean? What does that mean? If 10% of your nerves deal with pain and 90% deal with function, what does that mean to your health? What does that mean to your body?
It means that your organ probably will not work as efficiently as it should.
Well, what it means is this, is you may not have any pain, but a tremendous loss of function.
There you go.
And not even know it.
Yeah.
And people say to me all the time, oh yeah, I don't need chiropractic, man, I feel good. I don't have any pain. Really? Well, what's your function like? How well is your pancreas function? How well are your adrenal glands functioning? You know, what's your grip strength like? In other words, you know, we disassociate pain and function. So let me ask you this. Anybody ever in here ever hear of somebody that had stage 4 cancer, went to the doctor, and it was discovered by the doctor and they had no pain? Stage 3 or stage 4. Anybody hear that?
Yeah.
I have. You know? So was their body functioning well? Absolutely not. But they had no pain. Pain is a very poor indicator of how healthy you are. I can tell you that. So, an individual who has a nervous system free of interference can fight off infections much easier. Now, children, you know, when they're subluxated, they may not feel pain. Instead, what do they get? Colds, allergies, food intolerances, behavioral issues, ear infections, sore throats, all stem from interference from the brain to the body with kids. You adjust those kids, and a lot of them get better, a lot better. There's an article in a prominent neurobiology journal in 2014 that stated the following regarding nerves that arise from the upper neck right here. These nerves have a great influence over your heart and your breathing, cardiovascular and respiratory area. Very interesting. They're not talking about pain there, they're talking about function. It said stimulation of these areas can influence the cardiovascular respiratory areas. This area also influences the entire autonomic nervous system and influences whole body health. Okay, this is not a chiropractic journal. This is a neurobiology journal talking about the influence of the upper cervical spine. This is all about function, not about pain. So that's why it's difficult for some people to understand how chiropractic can work. So some people say you have to go over and over for the rest of your life. You can stop anytime, okay? Carmen has never put a chain on the door, okay? I've never asked her to do that, okay? You can only come back when it hurts. But let me ask you this. Do we brush our teeth only when they hurt?
Sometimes.
Yes, some people do.
Yeah.
Yeah, there are some people that do. Some people only change your oil or put oil in when their oil light comes on.
Yeah.
Those are usually college-age girls, okay?
Yeah.
Uh,
Some guys too.
So we don't brush our teeth only when they hurt, okay? We brush them because we want to keep them, all right? So Tour de France riders don't get adjusted because their backs hurt. They get adjusted because they perform better. Race horses get adjusted. Why? Because breeders and jockeys know that it helps their performance. Animals are much healthier and live longer when they're adjusted. The veterinarian that trained me in animal chiropractic says this. You can find it on his website, vomtech.com. He makes a statement. He says, animals live 30% longer when they're adjusted. And that 30%, they live a lot healthier. 30% longer. So that's a little dog being adjusted, and that's how I adjust dogs. As doctors of chiropractic, we don't just adjust people, get them out of pain. Although we do that, that's not the only reason we do it. We adjust them because it's the right thing to do. We do a lot of things because it's the right thing. We drink more water because it's the right thing. We take supplements to help our bodies work better because it's the right thing. We do it because it enhances our expression of life. We exercise because it's the right thing to do. It makes our expression of life more robust. Now, my goal is not just to get you out of pain, okay? That's part of my goal, okay? I want to get you out of pain, but it's to teach you to take better care of yourself. It's to teach you that the brain-body process requires 100% Efferent Pathway. Again, this is not somebody's theory opinion. The scientific evidence is overwhelming of this fact right here. A properly functioning afferent nervous system will give us a much greater chance of being healthy as we get older. Now, I want to ask you a question. Let's talk about vital needs. And some of you heard me say this before. What are the needs that our body has to stay alive? What do we have to have? Okay. We have to have water. What else do we need? Air. What else do we need? Food. Okay. How long can you go without eating?
30 days, a week or 30 days, depending on your fat level.
Well, I've done a week, and I did fine. Okay, so you can go longer than that.
Depends on if you're obese.
Okay, so the average of a non-obese male in the United States can go 60 days without eating before he dies. Okay, now an obese male can go a year without eating before they die. Okay, so we need food. We at least, so if somebody's starving, you don't give them a glass of water, you give them some food. Okay, how long can we go without water?
A couple days.
Yeah. I know you can go at least 3 days, but maybe possibly 5 to 7 days. Possibly, okay? So somebody that's gone 5 to 7 days, you want to hydrate them, okay? Their body needs to be hydrated. How long can you go without oxygen?
Give me a few minutes, I'll tell you.
Yeah, a few minutes, right.
3 minutes maximum.
Yeah, that's about right. Maybe 3 minutes, okay, and then you die.
Yeah.
And somebody that's starving for oxygen, you don't give them a glass of water, right?
No.
You give them oxygen.
No.
So what's the thing you can't go for 1 second without?
Nerve flow.
Nerve flow, right. We talked about it earlier. You cut the head off, die instantly. You cannot go for 1 second. That's why we adjust the spine, because we want to enhance nerve flow, because you cannot live without it. So, I want you to think of somebody. My goal is to bring health, hope, and healing to Lincoln. That's my mission statement, to bring health, hope, and healing to Lincoln. I want you to think of somebody that needs health, hope, and healing. And we would be happy to schedule them at my office. We do a complimentary subluxation check. And if they don't have a problem that we can help, we'll send them to someone else. But if they do have a problem, this chiropractic may be their only solution, and we want to help those people. So you can talk to Carmen about that, and she can help you schedule those people. Thank you so much. It's a little after 7. I went just a minute longer. Thank you so much for being here tonight. Next time, in 2 weeks, we're going to talk about vertigo, how chiropractic and the research supports chiropractic helping vertigo. So God bless you guys. Have a good evening.